Hi, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today we're going to watch a cavity filling procedure at the dentist. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to discover all of the essential components for an effective oral hygiene routine to help maintain a healthy smile by preventing cavities. And having said that, for today's video, let's walk through a cavity filling appointment. First, the dentist or the assistant may take your blood pressure prior to numbing you up. Next, they may apply a topical anesthetic on your tissue so you won't feel the pinch from the needle. Then you may receive local anesthetic. This way you'll be super numb and you won't feel any of the drilling or the filling. After they numb you up, they will usually rinse out your mouth with water and wait for you to start getting numb. Once you're numb, the next step is to use the drill or an air abrasion instrument or a laser to remove the decayed area. In this case, in this video, the dentist is using a drill to remove the tooth decay cavity out of the tooth, starting with the high-speed handpiece drill. This specific high-speed handpiece drill sprays out water, so there will also be a suction and or a saliva ejector in the patient's mouth during the drilling to suction up the excess water. Next, the dentist will use a slow-speed handpiece, sometimes called Mr. Bumpy, to remove more decay. This drill does not spray out water, but they usually keep the suction in there anyway because of the debris and different particles. They don't want anything flying around. Next, the dentist may use a cavity detector, and if needed, the dentist will go back in with the handpieces to remove the remaining spots of tooth decay. By the way, this video is showing a small cavity on one surface of a tooth, which is an extremely straightforward type of cavity to fill. So sometimes cavities will contain more surfaces to be taken care of, including between the teeth, and that's when different types of matrix bands and wedges need to be used. And I will link that video of mine if you want to see a multiple surface filling appointment. But let's keep going with this appointment. Once all of the decay has been removed, the dentist will prepare the space for the filling by placing etch on the tooth. Etch is an acid gel and it's usually blue colored, and it's used to roughen the surface of the enamel. Then the etch will be rinsed and suctioned and dried to prepare for the next step. So you'll now notice that they have turned off the bright light because the tooth colored fillings are actually hardened by this light. This type of filling, the composite filling, is applied in layers, and right now you're watching the first step of the bonding agent where they brush it on to etch and prime the tooth. The next step is the adhesive, which is light cured. So after brushing it on, they will use the special light to harden it. Now the tooth is one step closer to being ready for the composite, also called the tooth colored filling or the resin. Now you can see how fast this step is. I didn't even edit it at all. It's just right, put in, boom. Placing the filling material in there takes like 1 second, but the part that takes much more time is using the different dental instruments to pack it and make it look like a tooth. So dentists will spend some time making it look good. They want to mold the composite filling material that they just placed in there to match the shape of the surrounding tooth. Once the dentist is ready and happy with the shape, after using multiple instruments to shape it, then they will light cure it to harden it. So this filling in particular is not in a spot where the patient would bite on it. Also, like we said, it was super straightforward, only putting the filling material in once. But sometimes they have to repeat that stuff of packing and shaping and packing and shaping if it's a bigger cavity. But for this video's sake, we acted out the articulating paper step to check the bite. Lastly, they will finish the filling by polishing the final restoration so it's nice and smooth. And that's it. Filling appointments are not too bad. Once you're numb, you don't feel a thing. But still, even though filling appointments are easy, if you can avoid needing a filling by avoiding getting cavities, that's always best. So be sure to keep up with your daily routine of brushing and flossing at home. And if you're interested in creating the perfect routine at home, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide. I hope you enjoyed this video. Please like, subscribe, and turn on your notifications if you did. And if you want even more dental tips, you can hang out with me on Instagram @TeethTalkGirl. Peace, love, and teeth.